Bismillahirrahmanirrahim. Now, after learning about the basics of endoscopic equipment, its disinfection, its indications, time out and sign out, now we'll talk about how to perform an endoscopy, how to perform a gastroscopy. Now, you must have seen in first section what are the different parts of a normal gastroscope. There is an insertion tube which goes inside the patient, and then there is an umbilical cord which is attached to the monitor or the processor. And this is the video processor in which this scope is particularly attached. Now, as you have seen initially already in that section related to the parts of the endoscope, that this insertion tube has got a light source, it has got a suction tube port, it has got an air water channel, while the umbilical cord is the one which is inserted into the processor before the start of the procedure. Now, at this end of the scope there is a control which is in your hand, which is basically in your right hand. There are two knobs. One is the bigger knob which is for the up and down movement, while there is a smaller knob which is for the right and left movement. This is for up and down and this is for the right and left, and this is the lock. Once you lock it, so this wheel will be fixed in that particular position. Similarly, the larger wheel also has got its own lock. So this control is in your hand. So whenever you are going to turn the big wheel toward your side, the front end of the scope is going to move up above and when you will turn it away from yourself, then the front end of the scope will move down. That's why you call it as an up and down knob. So here is how you hold the scope. There are two techniques, either this technique where you are going to use your index and middle finger for both the knobs. The upper port is basically for air and water. The upper port is for suction, while the lower one is for air and water. If you just put your finger on this particular knob, this will just give the air within the stomach or duodenum, while if you press it, that there will be water jet that will be coming out of the front end. While when you press this upper knob, this will lead to suction of the air or the water, whatever you want to suck up. So now you see, this is the control that you have. You use your index finger to move these knobs up and down and right and left, while you use these fingers for the control of this suction and air and water channels. So this is how you hold now. Your position is in left, the patient is in left lateral position. Mouthpiece is in the mouth. That will ensure that the scope is not bitten by the patient. And this is how you are going to hold. Just stay a bit 1 to 2 feet away from the patient. You need to hold this particular insertion tube in this hand. And you see this this scope should be at least held at beyond 20 centimeter mark, so that once you start crossing the hypopharynx, you should not need to change your grip on the scope. That's the first step. Whenever you place your insertion tube into the oral cavity, this is the first view that you will get. This is the tongue, this is the hard palate, there's the uvula. So your first movement is down. You go close to this uvula. Once you are here, then you start going up and moving forward. Once you go forward, the next view that you will face is this, where this is basically the larynx, these are the vocal cords, and this is the piriform fossa, and this is the place where we have to enter. So you first go down, then you turn the wheel up, and then once you are in this position, turn the wheel down and will slightly and gently push the scope forward. Now let me show you how a normal upper GI endoscopy is done, and then we will review the same video and we'll see what are the different steps at different point which are being done in this.
कंसेंट हो गई की साइन चले ब्लड प्रेशर चेक कर लिया हमने 150 सैचुरेशन भी नॉर्मल है मैम सेडेशन दे दें We are ready?
Yes, sir.
Chalo.
ऊपर सर इसोफेगस खत्म हो गया
जी डन स्टॉप
Now let's see this video again, and I will tell you what are the different steps that are being done during this particular procedure. So first we are basically doing timeout, where we are checking the identity of the patient, the indication for procedure, and the consent which has been taken or not, fitness of the patient for procedure, and then there is a monitor attached which is showing saturation, pressure. So once these are done, then the staff is going to give sedation. We usually use propofol for short sedation anesthesia during the procedure. Now, while that, I have taken up the scope and I have checked both the suction and air water channels. This is when I'm checking the functioning of those channels to ensure that are in proper function before the procedure. Now first thing is, you see where I have held the scope in the right hand. Now first movement is down. We have gone toward, keep an eye on my fingers, down toward the heart palate. Then the up movement, little suction here. You need to make sure that there are no secretions in the oral cavity. Now once we are in there, this is down and rotation, and we are into the esophagus. In esophagus, you don't need to use any veil. You just need to give air, keep moving forward, and use rotatory movement of your left hand to make a proper view if needed. So you can see we are moving forward. This is the lower esophageal esophagus with gastroesophageal junction visible now. Once you crosses it, you are into stomach, and now you can see there are longitudinal folds going toward the right. So what I have done is I've just lifted the scope, and you see the rotation. The scope has rotated in the stomach toward the entry. So again, a little upward movement and pushing the scope, and now you can see the pylorus. Now this pylorus needs to be kept in the center of the view if you want to enter into the duodenum, and here we are into the duodenal bulb. Then is the rotation toward the right, and you see now we are in the second part of the duodenum, which is identified by those circular folds which are visible on the monitor. Now we are coming back, and while coming back, examining all the second part of the duodenum, generally scope slips back, while coming to the bulb, so you again have to go into the bulb and complete your examination. Now we are back into the stomach, we are seeing the body. You keep an eye on my hand movements. So I have came back to gastroesophageal junction and then rotated the scope and turned it upward, and now you can see the fundus of the stomach. That's black is the scope, and the fundus of the stomach is visible, which can easily be examined by rotating scope from right to left or left to right. Once it is done, then you need to do suction to take the air out which you have inflated in the stomach during the procedure, and you start coming out, slowly examining the esophagus again, giving little air, using your wheels very judiciously to make minimal maneuvers. Most of the time you use movement of your hand to make a good position. So that's how a normal endoscope, upper G endoscope, is carried out. So you see, for a beginner, there are areas which can be difficult. One is passing the upper esophageal sphincter, and that I have explained. The movement needed would be down, up, and full down, and slight gentle push. Then the second important thing is how to turn across lesser curve in the stomach. So that you just have to lift the scope up, and that turns toward the right side, as you saw in the video. Then the pylorus should be kept in mind in the center of the air view. That's the only way of going across the pylorus. For descending duodenum, you need to turn the scope toward the right and give a slight push. So these are the 4 steps we have already explained. And then the fundus, you have seen how do we examine the fundus. So these are few steps which needs to be practiced, and that ultimately leads to good performance of the gastroscope. But remember, it's a skill, and it comes with time, and it needs, and the learner has to go through all the steps of skill learning. So first you will have to observe, then you have to do imitation, manipulation, precision, articulation, and obviously with practice you will reach a stage where naturalization will come, and you will start performing not only diagnostic but very difficult therapeutic procedures as well on endoscopy. So with this I end this session, and I hope this must have helped you in identifying the basic steps you need to follow while performing an endoscopy. Thank you very much.